Hello, and welcome to Synapse, where we talk all things innovation with some of Florida's top innovators. I'm Lauren Prager, your host, and I'm so pleased to be bringing this to you today from Bake More Pies studio in beautiful Tampa Bay, Florida. And as we get into today's show, we're going to have a chance to talk about one of my favorite activities and innovation initiatives that we focus on here at Synapse, and that's our innovation challenges. These are unbelievable resources that we use to connect innovators in our community with the organizations and companies that can really make use of their talent so that they can find solutions for their needs much more quickly and much more inexpensively than traditional research and development. Today, I am joined by Summer Cruff. Welcome, Summer.
Thank you. I'm so happy to be here.
I'm happy to have you. Summer comes to us from YMCA of the Suncoast. We recently had a special opportunity supported by our partner, the SunTrust Foundation, to host a series of Synapse Innovation Challenges with their support. And after an exciting and very rigorous application process, we selected 3 organizations from across the state to participate, and YMCA of the Suncoast is one of those that was selected. So we're excited to welcome you here and give our audience members a chance to learn more about how innovative YMCA really is and the specific innovation challenge that you're posing to the community so that they can get involved and help you out.
Thank you so much. Again, we're so happy to be here.
So I wanted to take a moment for you to share a little bit about the YMCA, because a lot of us know the YMCA. We go there to work out and hang out. It's a community organization, but there are a lot of layers to the ways that YMCA really improves the lives of our community members. So tell us a little bit about that.
Sure. So a lot of people think of the YMCA as kind of a gym and swim, or childcare, right? So whatever way you use it, either as a gym or as a childcare facility. And while we do both of those things, we also do a lot of other great work for the community. So the Y is a nonprofit organization, so we don't turn anyone away due to an inability to pay. So no matter what that is, if it's for our regular programs and services like swim lessons or summer camp or a gym membership or some of the innovation things we're doing around healthy living and in community health. So the Y is for youth development, healthy living, and social responsibility. And today we're going to kind of talk about the innovation we have around healthy living.
I love that, and I have taken advantage of all of those as a Y member, so I appreciate the way that you serve and support the community. And share a little bit, please, about YMCA of the Suncoast. Who's your community, and what is the membership like that you're serving?
Sure. So we have 8 branch locations across 4 counties. So we're in kind of the north and central part of Pinellas County, west Pasco, and then Hernando and Citrus County. And we serve about 46,000 people coming in and out of our doors every day.
46,000 every day.
Yeah. Depending on how often you come to the Y.
And you should go and work out, all of you Y members who are sitting on your memberships. That's impressive, and that's a part of our community that's growing dramatically. So, I would imagine that you're seeing membership increases as more and more communities are growing and developing there, and you have more of a presence.
Yes, for sure. Our newest location is our northernmost one, so in Citrus County, and it's a beautiful YMCA and really serving the community there.
Fabulous. And you have now been with the YMCA for
10 years.
Yes.
Which is crazy.
Congratulations.
Yeah. Thank you.
That's a really special milestone.
It is, yeah.
And your focus is on the community health initiative. So share a little bit about your background and what you're bringing into this, because you've seen this grow and change, and health and wellness is such an important area that's seeing so much innovation right now. It's exciting to figure out a way to pair that innovation with the YMCA's work in the community.
Yeah, so my background is really in exercise and nutrition. So I started working at the Y purely as one of the directors there helping run the gym. So the reason why people normally come to the Y. And as we got, as a YMCA organization, more and more involved in community health, I kind of have leaned more and more that way. So now I have the pleasure of really interacting only with our community health programs. So we run a series of evidence-based programs. And I know a lot of people don't know what that really means.
Right.
So programs that have been researched and proven to impact impact people's health. So proven results, which is really nice. So for example, one of our programs is the diabetes prevention program. So there's research and evidence that shows if people make specific changes to some things that they're doing through this evidence-based program, they reduce the risk for developing diabetes. So we have programs like that that really impact the health of our community. And so I've been able to get involved in those and help really serve members of our community that might not otherwise come into the doors of the Y or get the prevention and chronic disease management help that they need.
That's it's pretty special to understand the way that you're serving this community and really helping to improve health and wellness, and your own professional journey, as you had shared with me previously, that you've really grown and evolved and expanded your own role and your interest in health and wellness. So it's exciting to have you here and see how that journey evolves. But I understand that the way that you're working with some of your members on these evidence-based programs is a little bit cumbersome, a little bit old school. So we are here today to talk about how we can help you to modernize and bring your evidence-based programs and your data collection into the next era. So let's talk about the challenge that you presented to the SunTrust Foundation and that we want you to get help from the community with.
Yeah, great. And we're really good with people at the Y. That's like our thing. We're so good at serving people and building relationships. We're not good at technology and innovation in that way. So we're so happy that we have an opportunity to get some of our problems solved. So one of the cumbersome things that we do is we receive referrals from the medical community for people and participants and patients from those practices to participate in our programs. And so we receive those via a secure fax. And once we receive that information, we're really tracking everything that happens with that person, from a phone call to, what's their address and their date of birth on an Excel spreadsheet.
Wait, you started by saying that you get it by fax.
We do, I know.
You
which
probably have the last remaining fax machines left in use, and not in a Smithsonian museum or something.
No,
okay.
It is an electronic fax from a medical provider, which I think, I'm going to tell myself is a little more acceptable because it's, a medical thing that happens, but maybe not. We do receive that. And so we're putting them on a spreadsheet. And
who's putting them? You mean your staff is sitting and typing manually what they got from the fax into a spreadsheet?
Yeah.
Got it.
So they type that person's information in there and then kind of just track them through Excel spreadsheet columns, kind of every piece of what happens to them. So did we call them? What date did we call them? Did they answer? Did they, tell us to call them back? What kind of insurance do they have? Are they going to enroll? And so thinking about the number of times that the staff person has to go back and find that person in the spreadsheet and kind of re-enter information really uses up a lot of staff time. And then what really is the going to make you cringe part is at the end of every month, we want to do some reporting. So we really have gotten heavy on our data, which is good because we want to prove that the program's working and that we're helping people. But because we don't have great systems to do that, we go through and we count how many people are kind of in different stages of the program, manually on the spreadsheet, count things. So
using the sum function and trying to understand.
I told you I can barely use Excel. So no, we do some, pivot tables and very simple calculations, but it's all pretty manual.
And how frequently are you entering data into this Excel spreadsheet?
Daily. So we do access that information daily, where we're either putting in new people that are, coming to us or going back and, we've contacted someone who previously maybe we were playing phone tag with or whatever. So we're really in that daily.
Okay. And when you say we, who is the we and how many we's are there?
Good question. So myself, and then we have a program person who also does that. So there's two of us here, but we also, other YMCAs in the area. So in the Tampa Bay area, there's 3 Ys, and we kind of all use the same tracking system because we're all working with the same healthcare provider. So there's about 6 of us that are accessing the spreadsheet.
Okay. So you've got 6 people accessing an Excel spreadsheet, trying to track data for approximately how many participants in this type of a program?
Right now, year to date, probably 700. So our spreadsheet goes back, a couple years. So lots of people are in there.
Okay.
Yeah.
So somewhere in the cloud is a document that's tracking this data that could be very, very useful. So talk a little bit about why you're collecting this data and how you're utilizing it to improve the healthcare and nutrition and wellness of both your participants, your members, and your community programs.
Yeah, so most of the people who enter one of these community health programs are not members of the Y. So it's really great because they otherwise aren't seeking, kind of that self-motivated healthcare that we know people need, so exercise and nutrition information. So because we have these evidence-based programs that physicians are really enjoying, they send their patients to us. So we have the opportunity to kind of take them in, provide them this evidence-based service, and then hopefully get them involved for the future. So once you've completed this service, what are you going to do now?
Right.
So is there some other program you can get involved in, or can we just get you active in your community? So it's really helping both sides of that. And then all of the information and even the part that we kind of count manually, we're able to provide that back to the healthcare community that's providing the referrals to us to show that we're making a difference. And so in the future, we hope that leads to more, revenue streams to our program so we can help more people. It also would allow us to apply for more grants where we could serve people that couldn't otherwise afford to participate in the program, and just really prove that the program is working not only nationally with that evidence-based research, but also in our community.
And do the participants of these programs have an opportunity to see and understand their progress and how the data is being used so that they can be encouraged by their progress? Is that something that you're able to do when you're working off of pivot tables and an Excel, a very, very long Excel spreadsheet?
Yeah, they do. So with a couple of our programs, because of some other stuff that we do with them, we kind of have to use other database systems as well. So we do kind of the referral management, we'll call it. So from the time your doctor sent you to one of these resources to when you get enrolled in the program. And then once you've gotten enrolled, you're in this separate database system that we use, and that can help us track outcomes that we can provide to the participants. And so they can, have that self-motivation to, look, I've done great, this is great, or maybe, I think I should work a little harder. So either way, and then also, report that information back to their healthcare provider if that's the person they wanted to give it to.
Sure. Is there any integration at all with the fitness wearables, your Fitbit, your Apple Watch, any of those monitoring systems that people use? Is that something that is even on the radar screen?
I will say that it's not on our radar screen just because we know they don't talk to Excel. But maybe in the future, if there was something that was, working for us, that would help. We know for a couple of our programs, people are tracking their physical activity minutes. So we know that they would enjoy doing that. That same program tracks what people eat. So lots of people put their information into MyFitnessPal.
Sure.
So then they have to print it out and bring it to class because we don't have a way for it to kind of integrate with the lifestyle coach who might look at it or anything like that.
So you're really operating kind of in a silo. So part of the goal is not only data collection, but data integration.
Yeah, that would be awesome as well.
Okay. You mentioned that the data that you collect is used and sent for billing so that you can fund these programs. So talk a little bit about that platform, because when we think about challenges that are technically based, we want to make sure that we're transparent about any potential limitations. And you have a system that's not changing. You guys like it. You use it. And so what is it and what do we need to know about it?
So we use a third-party vendor that helps us bill insurance providers for our services. And so we have to once the participant enrolls in the program, we have to put them in this other system. And we know the back-end part of that system is Salesforce. And so we put them in there, and that helps track their data. And then that third-party vendor kind of pulls the information out and sends it off to be billed to whoever the insurance provider is that might be paying for the program. So one of the limitations is that we have to use that. So as far as reporting data for the program, once the participants are in there, we have to use that. So one of the things you and I were talking about is we would love to be able to send physicians like progress reports. And we, have done that in varying capacities over the years, but it's so manual. So we have to kind of go, oh, this person, let me remember you've hit your, halfway point of the program. So let me look up your doctor information and then go in the other database system and look up your outcomes and send them to the doctor. So if there was a way that we could do the progress report letters and kind of even just, hey, that person enrolled in the program, and then leave it to the participant to do progress report. Any of that would be super helpful for us.
Wow. Okay. So there's a lot of potential. And when we think about health and wellness, we really want to think about it comprehensively. And if you've got people who are willing to enroll in the program and work with their physician on a program that works best for their needs, accountability and accessibility to that data is so critically important. So when people really kind of step up, you want to encourage that. And that transparency would really, I would imagine, do a lot to encourage people to continue on in that journey.
Yes, we know that people who are referred to any of our programs by their physician perform tenfold to the participant who just saw a poster or heard about it from a friend. Those people do great too, but we know that the people who have a vested interest in, reporting back to their doctor that they did what they said, they do better. So any accountability we could create by sending those progress reports and saying like, hey, your patient's in the program and they're attending. So, kind of next time they come for an appointment, ask them about it.
Right.
And then it just helps with that extra layer of communication.
Right. This could be really a very powerful way for you to accelerate the impact of the work that you're already doing to help this growing community get healthy and stay healthy.
Yes, definitely.
It's exciting. And to all of those of you who are watching and thinking about the tools, the skills that you have to build something that could be of value to the YMCA, not just it sounds like the YMCA Suncoast, but all of your partners around the Tampa Bay area who have initiatives like this. I hope that this is very inspiring. There's so many ways that technology can be an accelerator, and innovation integrates with this so beautifully. So, this is a great way for all of you to really think about the experience that you have, how you feel about going to exercise and taking care of yourself, and then integrating all of that data so that it can be a lot more useful for our friends at the Y. You told me that you have a giant data backlog with 700 on an Excel spreadsheet.
We do.
It's
we've been using the spreadsheet for a while. And so, in order to make all the data usable, we would eventually have to put all those people into whatever solution we have. So there's lots of them, but it would be worth it, backlogging them in.
Yeah. So this is a challenge that's really going to impact not only the YMCA, but a lot of people in our community. And I think that it's a great opportunity for all of us to think about how we can make an impact for the YMCA. So I'm excited to see what our participants come up with. So a little bit about the mechanics of how the Synapse challenges work. If you go to, there it is on the screen, synapsefl.com/challenges, you'll see a summary of this particular innovation challenge and a link where you can register to sign up. You'll have until October 11th to register. And then from there, you'll have a couple of weeks through Thanksgiving to come up with your solution. And we'll send the questions you have to Summer and our friends at the YMCA so that you can get all the data points that you need. And once that's all come together, we'll select our finalists from all of you who submit your projects. And the grand prize will be awarded at our pitch event in December. What's our date? December 10th. The grand prize for this particular challenge, thanks to sponsorship from the SunTrust Foundation, is $7,000 cash, plus 2 VIP tickets to Synapse Summit 2020, Synapse's premier innovation celebration that takes place annually at the Amalie Arena in downtown Tampa Bay, beautiful downtown Tampa. So you'll have a chance to connect with more than 6,000 innovators across industries, technologies from all across the state, the country, and even the world who travel to Tampa to understand the opportunities and innovations in our community. So I think that covers our goals for today. I'm very excited to see what our community comes up with. Thank you for challenging our community and crowdsourcing some solutions for the YMCA.
Thank you so much for having us and for considering our problem to be solved. So we look forward to it.
Terrific. Thanks, everyone. That's our wrap for today. We'll see you next time. Keep innovating.